Good morning, folks. We're just going to be getting going in a minute or two here. All right, I think it's 1 minute after. Just want to welcome everyone and thank you for joining this presentation on Assembly Bill Assembly Bill 665. This has been guidance that we've been kind of working on at the department and refining divisionally within the department for the last few months, and have been working with various stakeholders who were really absolutely critical in getting the guidance in a place where we needed it to be. And so I just want to give a special call out before we get going to some of these organizations. This is not inclusive of everyone that has helped support this effort, but there are those that we worked with particularly closely on this, and that included the National Center for Youth Law, the National Health Law Program, the California Alliance of Child and Family Services, the Children's Partnership, and also our County Behavioral Health Plan and Medi-Cal Managed Care Plan associations. And again, there were a lot of different stakeholders that we worked with, but these organizations provided really helpful support in getting to a place getting to the place that we are today. So I think we're ready to get into our introductions. Yep, and incidentally, that includes me. So I am Ivan Bardwaj. I'm the chief of the Medi-Cal Behavioral Health Policy Division. I am also the chief dad in my house of an incredibly stubborn and rambunctious 2-year-old. And to be honest, I don't know if I'm the chief or he's the chief. We're still figuring that one out. So more to come on that front. But my team and I at the policy division, we oversee policy components of the Medi-Cal behavioral health delivery systems. So that is drug Medi-Cal organized delivery system, and the county mental health plans. We also oversee various initiatives that includes, most of the behavioral health components of CalAIM, BH Connect, 988, the Medi-Cal Mobile Crisis Services Benefit, peer support services, the Community Assistance Recovery and Empowerment Act, AOT, and a few others. So a pretty wide scope. And I also just wanted to note that we had an unplanned scheduling conflict today on my part, where I have to jump in about 15 minutes and drive over to our downtown offices for an in-person presentation at our California Health and Human Services parent agency. So I do apologize for that. But I am joined by one of my colleagues at the policy division, and that is Jessica Jenkins. She'll be carrying us through much of the presentation and has been really critical in the development of this policy on the behavioral health side. So you'll be in great hands as we do our policy deep dive, and I will pass the unmute button to her to introduce herself.
Thanks, Ivan. Hi, everyone. My name is Jessica Jenkins. I'm a health program specialist too in the Medi-Cal Behavioral Health Policy Division here at DHCS.
Awesome. Thank you, Jessica. And I would be remiss if I did not mention some of our other colleagues on the call. We have our DHCS Managed Care Quality and Monitoring Division. Managed to do that without stumbling over it. But we also have our DHCS Benefits and Eligibility Division teams, and they'll be here to kind of help answer questions. Also want to note that we have a Rare Health Group here. They're helping kind of facilitate today's webinar, and also just wanted to call out a special thanks to Aurora for helping consult on this program. It is not an easy department, to work across divisions and to really get, clear and aligned across our different policy areas. And so they were really just critical in helping project management manage this effort. So thank you to Aurora. So with that said, let's we're in the agenda. So we have a pretty tight meeting. It's a 1-hour meeting, and before we get too far, we'll initially cover some housekeeping items, and then the focus for today will be around AB 665 implementation guidance that was developed specific to county mental health plans. And that is, the vehicle for that is the Behavioral Health Information Notice 24-046, which was published last month. And we've been, receiving questions, and I imagine some of you here today will have questions around limited scope Medi-Cal minor consent services, otherwise known as the minor consent program. So again, to be clear, we're going to be focusing on the recently published Behavioral Health Information Notice. And outside of AB 665, we haven't made any, formal policy changes to limited scope minor consent services or the minor consent program. So, with that said, we do recognize that there are general questions and technical assistance needs for minor consent services as a whole, and we will track those questions as they arise. And we're considering how best to address these questions, whether it's in an FAQ, implementation guidance, or kind of a future technical assistance webinar. And we'll keep you posted on that. This is kind of evolving as we hear more from stakeholders and what their needs are. And we're really really intending for this webinar again to be focused on the behavioral health information notice and some of the other companion documents that I'll get into in a second. But we'll be continuing to provide post-implementation guidance specific around AB 665 itself. So there's more to come on that, and we'll be gathering questions that we receive, and we'll be putting them in an FAQ following this webinar. We want to make sure that our information is as comprehensive as possible, and we may get some questions today that we're not able to respond to right away, and that's because the policy is particularly nuanced. And I think, what I tell my team is one of the best things you can say is, I don't know, but let me find out. And we'll certainly do that as well on our end. But I would go ahead and encourage you to, drop your questions in the Q&A box. And if we can't get to them today, we'll certainly get to them in the future. And we'll obviously work to consolidate those questions that are almost, identical in nature to make sure that we have comprehensive guidance, that we're consolidating our guidance, and that you have something to reference that is as comprehensive as it possibly can be. So with that out of our way, I will pass it on to Sarah from Aurora to walk us through our housekeeping items.
Thanks, Ivan. Good morning, everyone. I'm Sarah with Aurora Health Group, and I'm going to walk us through a few housekeeping items for our webinar today. To start, please note that today's webinar is being recorded, and both the recording and an ADA accessible copy of the webinar slides will be posted to the DHCS webpage for your reference following the webinar. Once these are posted to the webpage, the links will be shared via the Behavioral Health Stakeholder Updates email that comes out each week. If you're not already subscribed to those emails, we'll drop the link to subscribe into the chat now. And next up, we'll move to the instructions for closed captioning. So for those who would like live captioning in either English or Spanish for the webinar, please click on the applicable link in the chat. I believe these were dropped in just a few moments ago. We recommend opening the captioning into a separate window to view alongside the webinar, as clicking on the link may pull up a new screen in your internet browser. You may also click on the closed caption button on the Zoom webinar window for live captions throughout the webinar. And if you have any questions about how to use Zoom, please go ahead and submit your question to Alyssa at Aurora Health Group via the email on the slide, which we're also dropping into the chat now. And last, as mentioned earlier, we will have time at the end of today's webinar to answer questions. Please feel free to submit questions at any point in the webinar by clicking on the Q&A button on your screen. DHCS will answer these questions as time allows, and will compile all questions to inform an FAQ to be released after the webinar. The FAQ will be released via the weekly behavioral health stakeholder e-blast, so please be sure to subscribe via the link in the chat. And with that, I'll pass back to Ivan to jump into today's webinar content.
Awesome. Thank you, Sarah. So yeah, let's get into it. So we'll start with kind of a high-level background and overview. The bill was originally signed by Governor Newsom in the fall of 2023, and it went into effect July 1st, 2024. And the bill essentially amended, repealed, and added to Section 6924 of the California Family Code, which is the area that covers, minor consent services for outpatient mental health treatment or counseling. Before July 1st, 2024, minors could only consent to these services without a parent or guardian's consent if certain requirements were met. And those included, the minor would present a danger or serious physical or mental harm to self or others without mental health treatment or counseling, or was the alleged victim of incest or child abuse. And the minor, in the opinion of the attending professional person, was also mature enough to participate intelligently in the outpatient services. So in addition to removing the first requirement, the bill also added, additional provider types to the definition of what constitutes a professional person. And, it also aligns with existing law by requiring that outpatient mental health treatment or counseling services involve the parent or guardian unless, after consulting with the minor, the professional person determines that the involvement would be inappropriate. So ultimately, the bill's goal was to reduce the barriers for minors to be able to access, necessary outpatient mental health services. Next slide, please. So this slide highlights a couple of areas of what AB 665 does not change. And first and foremost, the bill doesn't change limited scope Medi-Cal minor consent services. As I noted, that's the minor consent program. Those remain unchanged. So the bill also did not change protections for minor confidentiality and parent guardian notification. In other words, county mental health plans, Medi-Cal managed care plans, and providers are subject to all of the existing and applicable laws and regulations related to minor consent, to minors to be able to seek out to outpatient mental health services. And additionally, AB 665 did not change existing provisions related to consent for medication services. And specifically, minors can't receive narcotic replacement therapy, psychotropic drugs, convulsive therapy, or psychosurgery without parent or guardian consent. Next slide. So as I mentioned, this webinar is focused on policy updates released through BHIN 24-046. But I want to also acknowledge that there are other companion documents that have been updated and have been released or entirely new. So we have an all-plan letter with provisions that are consistent with AB 665. We've also updated our Medi-Cal provider manual and our eligibility procedures manuals to make sure that those are, again, consistent with AB 665. So we'll share a little bit more about that at the tail end of today's presentation. And so with that, I will pass it on to Jessica, who is our resident expert here from the behavioral health side. And then I will rush downtown for my in-person presentation. And I just, again, want to thank you all for attending. I really do appreciate it. And, Jessica, the floor is yours.
Thank you, Ivan. To provide an overview of the policy effective July 1st, 2024, minors 12 years of age and older may consent without a parent or guardian to receive outpatient mental health treatment or counseling if the professional person determines that the minor is mature enough to participate intelligently in outpatient services and that the professional person determines that involvement of the parent or guardian would not be appropriate. Please note that in accordance with Family Code 6924 and DHCS guidance, mental health plans and managed care plans must ensure that minors may consent to specialty mental health outpatient treatment or counseling and non-specialty mental health outpatient treatment or counseling, respectively. Next slide, please. Minors age 12 and older are eligible to consent to outpatient mental health treatment or counseling. Those who are not enrolled in full scope Medi-Cal must apply for limited scope minor consent services per the application process outlined in Section 4 of the Medi-Cal Member Eligibility Procedures Manual. Please note that for minors accessing limited scope Medi-Cal minor consent services, the minor will be assigned to a separate Medi-Cal case from the parent or guardian. Several professional types were added to the definition of professional person through AB 665. This includes a registered psychologist, registered psychosocial assistant, or psychology trainee while working under the supervision of a licensed professional, an associate clinical social worker, social work intern, or clinical counselor trainee while working under the supervision of a licensed professional, and a board certified or board eligible psychiatrist. These provider types are in addition to those previously included in the definition of professional person. Next slide. State law requires that outpatient mental health treatment or counseling of a minor authorized by Family Code, Section 6924, shall involve the parent or guardian, unless, after consulting with the minor, the professional person determines that the involvement would be inappropriate. After the professional person determines the involvement of the parent or guardian, they must note this decision in the client record, stating whether and when the person attempted to contact the minor's parent or guardian, and whether the attempt to contact was successful, or the reason why, in the professional person's opinion, it would be inappropriate to contact the minor's parent or guardian. In cases where the professional person has determined parent or guardian involvement would be inappropriate, mental health plans and providers must establish and ensure safeguards are in place. This includes appointment notices, notice of adverse benefit determination documents, and other related communication that would violate the minor's confidentiality. Claiming and billing for Medi-Cal minor consent services are dependent on if the minor is accessing full scope or limited scope minor consent services. For minors consenting to and accessing services through full scope Medi-Cal, mental health plans can claim in accordance with Medi-Cal specialty mental health billing guidance. For minors accessing services through limited scope Medi-Cal minor consent services, mental health plans shall continue to pay for services with county funds only. Please note that the minor's parent or guardian is not liable for payment for minor consent services unless the parent or guardian participates in the mental health treatment or counseling. In addition to releasing BHIN 24-046 to implement AB 665, other policy documents were updated to align with AB 665 implementation. This includes All Plan Letter 24-019 and applicable sections of the Medi-Cal Provider Manual and Medi-Cal Eligibility Procedures Manual. The updated Provider Manual is not live on the website yet, but it will be released soon. Links to these updated documents have been added to the chat for reference. DHCS will post an FAQ to our webpage in the coming months to address questions from stakeholders. The AB 665 implementation guidance documents that I mentioned are also available on our website. If you have questions related to BHIN 24-046, please email countysupport@dhcs.ca.gov. With that, I'm going to ask Aurora Health Group to lead us through the Q&A portion of our presentation.
Thanks, Jessica. We are now going to shift to our Q&A session. Please type your questions into the Q&A box and our team will compile them. For any questions that we are unable to get to today or where more research is needed, we will track those and provide written responses via the FAQ. So to start with our first question, how does AB 665 intersect with consent requirements for school-based mental health services provided via the CYBHI fee schedule program? Jessica, would you mind responding to this question?
Sure. Due to the complex overlapping policies in this area, local educational agencies or LEAs are encouraged to seek advice from the LEA's legal counsel to determine when parental consent is required to furnish behavioral health services to a student.
you. Our next question is, can Medi-Cal be claimed for all outpatient mental health treatment or counseling for youth with full scope Medi-Cal, even if the youth's parents are not involved and not aware of services? I'm going to ask Amara, who is joining us from the Managed Care Quality and Monitoring Division. Would you be willing to take this one?
Thank you, Sarah. Good morning. Yes, for the youth with full scope Medi-Cal, if the professional person consults with the minor and determines that involvement of the parent or guardian would not be appropriate, the minor can access those services without parent or guardian involvement, and those services are covered by Medi-Cal. Note that there are some limitations in what a minor can receive without a parent's consent, including psychotropic medication, convulsive therapy, and psychosurgery.
Thank you. Okay, up next, we have a question asking, what differentiates specialty mental health services delivered to a youth enrolled in full scope Medi-Cal from limited scope Medi-Cal minor consent services? I'm going to ask Sarah, who is with us from the Medi-Cal Eligibility Division. Would you mind providing a response for this one?
Sure. Good morning. Medi-Cal minor consent services are restricted to certain aid codes and diagnostic codes outlined in the provider manual. So that's the major distinction. Under limited scope Medi-Cal minor consent, outpatient mental health may be provided for 6 months, and beyond that, the minor must be recertified for continued care. Thanks.
Great, thank you. For our next question, I'd like to direct this one to Jessica. Could you remind us where we can find the full list of providers included under the definition of professional person?
A professional person means either a professional person as defined in Health and Safety Code, Section 124260, or a chief administrator of an agency referred to in Family Code, Section 6924. As covered during the presentation, AB 665 added several professionals to the definition of a professional person, including a registered psychologist, a registered psychosocial assistant, and a psychology trainee while working under the supervision of a licensed professional, an associate clinical social worker, a social work intern, a clinical counselor trainee while working under the supervision of a licensed professional, and a board certified or board eligible psychiatrist.
Thank you. And Jessica, before you go on mute, would you mind also answering our next question, which is, can minors consent to psychiatric medication services as part of outpatient mental health?
AB 665 did not make changes to this requirement. Minors cannot receive narcotic replacement therapy in a narcotic treatment program or psychotropic drugs, convulsive therapy, and psychosurgery without parental or guardian consent. However, a minor 16 years of age or older may consent to receive medications for opioid use disorder from a licensed narcotic treatment program as replacement narcotic therapy without the consent of the minor's parent or guardian, only if and to the extent expressly permitted by federal law.
Thank you. Amara, I'm going to ask if you're willing to respond to this next question. If a minor has another type of non-Medi-Cal insurance coverage, for example, via their parents' employment, and needs mental health services, must they seek services through their parents' insurance first?
Thank you. So minors can seek mental health services through their parents' insurance or through limited scope Medi-Cal minor consent services if they have concerns with parental notification.
Thank you. I'm going to ask Sarah to cover the next question, which is asking, if a minor calls in for help, how will a provider be able to verify their age?
Yeah, so minors do not have to verify their age. Minor consent services um, may be provided. They just need to self-attest. So minors do not need to provide any form of identification.
Great, thank you so much. The next two questions relate to youth and out-of-home care. And Jessica, I'm going to ask if you're willing to respond to both of these. First, do children and youth in out-of-home placement who are fully covered by Medi-Cal have to sign up for the limited scope Medi-Cal minor consent program in order to consent to outpatient mental health services?
Children and youth in out-of-home placement have two pathways available to consent to mental health services. One, as part of their full scope Medi-Cal coverage, or two, via limited scope Medi-Cal minor consent services. Per Welfare and Institutions Code, which has not changed or was not overridden by AB 665, all children in foster care have the right at age 12 years of age or older to consent or decline mental health services without the consent or knowledge of any adult.
Great, thank you. And the next question, also for Jessica, does AB 665 apply to minors in the juvenile justice system?
Youth age 12 and older have the ability to consent to outpatient mental health treatment or counseling services without their parent or guardian if the minor is mature enough to participate intelligently in the services, and that's per the Health and Safety Code. AB 665 expanded this consent standard to include Medi-Cal funded minor consent services per Family Code. We are not aware of any law that excludes justice-involved minors from the provisions above. The Welfare and Institutions Code focused on wards of juvenile court and states nothing in this section shall be construed to interfere with a minor's right to authorize or refuse medical, surgical, dental, or other care when the minor's consent for care is sufficient or specifically required pursuant to existing law.
Great, thank you. And for our final question, I'd like to ask Amara if you would be willing to respond. Do providers have to contact Medi-Cal to make sure no information about the minor's care is shared with their parents or caregivers?
Where involvement of the parent or guardian is determined to be inappropriate by a professional person, mental health plans, Medi-Cal managed care plans, and providers shall establish and ensure safeguards are in place to suppress confidential information that would violate the minor's confidentiality from being inappropriately delivered to the minor's parent or guardian, including but not limited to appointment notices, notices of adverse benefit determination documents, and any other related communication. Please see Parent Guardian Involvement and Notification sections located in the BHIN and the all-print letter.
Great, thank you so much. And thank you everyone for all of your thoughtful questions. We see there are still a lot of questions coming into the Q&A box. So as we're kind of assessing and seeing which ones we need to take back and research further, we will be holding some of those back to respond via the FAQ to make sure we're providing really thoughtful and accurate answers. So at this time, I also want to thank our panelists for providing responses. Again, please don't worry if your question wasn't answered live during the webinar. We will be doing additional research and releasing an FAQ in the coming months. Please subscribe to the weekly behavioral health stakeholder updates email to receive links to the webinar recording and to the FAQ once they become available. And we'll drop that link to subscribe into the chat again now. And with that, I'll hand it back to Jessica to close us out.
Thank you, everyone, so much for your participation. As Sarah noted, we will be taking these questions back and preparing an FAQ, and that will come out in a weekly e-blast when that information is available. I'll hand it back over to Aurora.
Thanks, Jessica. Since we are wrapping up a little bit early, we'll leave the webinar open for a few more minutes so everyone can get their questions into the Q&A. So we'll just, we'll give everyone about 5 minutes. We also have the county support email, which was dropped into the chat previously. Any questions that you think of in the future, you can feel free to send those to that email inbox. And so we'll just leave the webinar open for a few more minutes. And again, just, rest assured, all of your questions that came in that we didn't get to, we will be researching and providing thoughtful responses in the coming months. And thank you so much, everyone, for participating today.